got one of the largest state agencies. You've got such a huge economic impact with what your agency works on. What keeps you up at night as a physician, but also running such a large institution?
Yeah, that's a great question. We are an agency that, as was mentioned, is about 19,000 employees, a budget of around $39 billion, and 33 divisions within that. And we cover everything from Medicaid to food and nutrition to the licensing of facilities. So there are a lot of things that keep me up at night. I think one of them is that I really want to make sure that the programs and services we provide really reach all North Carolinians. And what gives me pause is when we're not able to do that. And so it's easy to think at the macro level, but what really keeps me up is when you think at the micro level, the individual that isn't able to go see the doctor, isn't able to fill that prescription, or in some cases isn't able to access their food and nutrition benefits. Because it's easy to think at a big level, but fundamentally at the individual level, we want to make sure we don't fail.
Yeah, and let me do a quick, I hate to jump in line ahead of you here, but we're going to run out of time, and I want to follow on the heels of that. So to that point, when you argue your point to those who make law, to policymakers, and you are the chief advocate for the health in North Carolina. So how do you include everyone in the General Assembly and have them feel the passion of what your argument is that you're making here
That's
now?
a great question. You know, first of all, I feel that they have the passion. In my 60 days of having an opportunity to meet with many of our elected leaders, they too feel passionate about it. They too feel the importance that this has for their constituents. For me, it's really focusing on the facts, keeping them basic and simple, ensuring that we're able to communicate that in a clear and concise fashion, and then reintroducing those facts, because sometimes it doesn't just end with one conversation. But I truly believe in our state that when we look across both the legislative side, the administrative side, everybody really wants to be a part of the solution.
Mm-hmm. We've about a minute and a half left. I want to get to, immigration is, again, hotly debated. And the policy, as far as I can tell, sir, is the idea that in North Carolina, Health and Human Services will address undocumented immigrants through emergency medicine and related services. I'm sure you want to expand that because you seem to be a guy with heart. How do you support the undocumented now, given that it's become such an acute debate?
Yeah, I look at it this way. There are 11 million people in the state of North Carolina, and we serve individuals who live in rural communities. We serve individuals who live in urban communities. We have programs that are specifically designed for disabled. We have programs that are designed to help individuals who are aging, veterans, children, and others. My focus is really on what do we need to do to ensure that our programs and services are working for all.
Does the General Assembly support that in principle, do you feel?
In my conversations, it's been pretty consistent that individuals really want to see what we can do for the best of North Carolina.